any samples, but just in case any of you are hungry, you might want to pay attention here. Jody?
Well, thank you so much. It's such an honor to be here. My business is called Cupcake Royale, and I did bring some samples, but you have some fierce security, so somebody might be enjoying them.
I suspect Secret Service confiscated them and are now eating them as we speak.
I see Duncan with a little bit of frosting on his. So yes, I did bring you some treats for the first family as well, because everybody loves cupcakes. But so I started my business in 2003. We were actually the first cupcake bakery that I know of that opened outside of Manhattan. And so it was a risky move. I came from corporate America and grew up there and decided to kind of spread my wings and give it a try. And we did really well. We now have 5 retail locations in the Puget Sound area. We have a thriving wholesale business. We employ 85 people, and we provide health care for people who work 30 hours or more. And I'm also a mother, as well as being a business owner, and my partner Kelly and I have a son named Truman, and he's 18 months. Nervous City here, you guys. So I guess the first thing I want to say is just very quickly, I worked very hard with Senator Murry to pass and fight for small businesses for healthcare legislation reform. And you guys passed that, and I just have great respect for that. There is not one small business owner that I know in the city of Seattle that I connect with that isn't looking forward to the implementation of the exchanges to reduce costs and bring higher quality insurance to small businesses. So we need that, so thank you.
That's great.
I just have to say that.
Good job, Patty.
Patty was a great leader and took a very early start in the Senate, and obviously Congressman McDermott as well. So that said, I also worked with the government to help me with my business. A year and a half ago, I had the opportunity to buy our 4th retail location in Capitol Hill. We were able to open a bakery and a cafe there, and it allowed us to really grow our business. I did this through the SBA 504 loan. So I was able to purchase a building in Capitol Hill in one of the hottest spots in the city. I only had to put down 10% versus if I walked into a bank, probably 25 or 30% for somebody in my position and length of business and that kind of thing. So I put 10% down. I was able to lock in a rate for 20 years that's really favorable and grow a business that added 15 jobs when we did that. As well, we had this huge new bakery, so we could grow a thriving wholesale business. In fact, we just added University of Washington to our wholesale accounts, along with a few other strategic players like Metropolitan Market and things like that. So we started growing with the momentum of this loan, grew this wholesale business, and then beyond that, just a month ago, we opened our 5th retail location, which is crazy, over the lake in Bellevue. And with that, we added another 15 jobs. So in the last 18 months, starting with this loan, we've been able to add 30 jobs. And I'm very proud of that. And that plus adding the salted caramel the day you were inaugurated has really helped our business to thrive. So I hear you're a big fan of salted caramel.
Absolutely.
And that's what I brought you, so.
Wonderful. Well, thank you so much. This is a wonderful story, Jody, and I just wanted to underscore something. Women-owned businesses have grown significantly faster than small businesses overall. But one of the challenges still ends up being financing. And one of the things that the Small Business Administration has done really well is that they are 3 times more likely to provide loans to women-owned businesses than regular banks have been. And so the story that you told about being able to access financing for what obviously is a great product and a great business model is something that we want to continue to emphasize. We had a big fight, some of you may remember, about a month and a half ago, where for 6 months we'd been advocating getting more financing to small businesses through the SBA and other mechanisms, as well as cutting taxes on small businesses. We finally were able to get that through the Senate, thanks to the hard work of folks like Patty. And that means that there are going to be companies like yours all across the country that are really going to be able to benefit. And I'm really looking forward to trying your cupcakes. So, fantastic. All right, now let's just open it up. So you can just raise your hand. We got a couple folks with mics here. Don't be shy, even though every word you say will be recorded by those people back there.
Hi, I'm Jordan Royer, and my wife Juliana is here with us. We have 2 daughters as well, so obviously what you're talking about, education, reform, science, mathematics, all of that is very important to us.
Right.
One of the things that I wanted to ask you, though, is it seems like in the media, the stuff we're talking about, the healthcare reform, which we've supported, and some of the other things that the Recovery Act,
Right.
there's a distortion that's happening on the facts
Right.
in the media. And the media, in our view, in my view, it should be a referee on that, and we're not getting that. And I'm just wondering how we can help you, what your plan is, and Senator Murray's and the other elected leaders here. How do we get the facts out to people? Because it really is hurting us that these distortions continue in the public sphere.
Well, look, I appreciate the question. First of all, I'll take healthcare first. Healthcare is just really big and complicated. And so the truth of the matter is we knew going into the debate that it would be subject to distortions, particularly because there were a number of interests out there that were doing pretty well through the status quo. And it's a multi-trillion-dollar business. And so if you're going to make significant changes to the system, it's going to have an impact on people's bottom lines, and they're going to fight back. And they did vociferously for a very long time. And that meant it was subject to some misleading information. As we begin to implement, I think we're going to have a better chance of clarifying what health reform means. So let me be very specific. You've got about 4 million small businesses out there right now, even before we set up the exchanges, who stand to get a tax break of up to 35% of the premiums that they're paying if they're already providing health insurance to their employees. So right off the bat, that can mean tens of thousands of dollars that small businesses are able to reinvest in new plants, new equipment, hiring a few extra workers, just because of the tax provisions that were in the Health Reform Act. Once they start seeing those benefits, it's a little harder for them to argue, boy, this is a terrible thing. Senior citizens have already started receiving $250 checks as a down payment on us closing the donut hole for those who have difficulty paying for their prescription drugs and have significant need. And so we've already got millions of people across the country who are receiving it. So instead of them thinking they're going to be death panels, now they connect health reform with the fact that this is helping them on their prescription drug coverage. Everybody here who has health insurance, what you're going to start discovering is that you now have a patient's bill of rights which didn't exist before and makes your insurance more secure. So everything from if you have somebody in your family with a pre-existing condition, being able to know that you can get coverage for them, to if you've got a young person who's graduating from college and they don't get health care on their first job, being able to stay on your coverage until they're 26 years old, to insurance companies not being able to drop you when you get sick just because of some fine print or you making some technical error in filling out your application. All those changes are suddenly going to mean something for people as they start using them more. Now, it also requires, though, us constantly beating the drum and being very clear about what exactly is in the bill. And look, the challenge that Patty's facing, because she's in the middle of an election, Jim and others are facing, is that we've got now tens of millions of dollars in every media market that is just constantly sending out negative ads, not really specifying what it is exactly about the health care bill that they don't like, other than just sort of a knee-jerk assertion that it's socialized medicine or it's a government takeover. And that obviously in the short term can have a negative impact on people's opinions. Over the long term, as I said, when people start seeing its impact on folks, and I think as more and more people see that the traditional health care that they got through their employer is being threatened by higher premiums and higher deductibles, and it's less reliable than it might have been before, I think that we're going to look back 20 years from now and say this was absolutely the right thing to do. When it comes to the Recovery Act, again, every specific provision in it, people like. So if you say 40% of the Recovery Act were tax cuts, not tax hikes, but tax cuts to small businesses, to 95% of working families, people say, well, that's a good idea. And then we say, well, and then a big chunk of it was infrastructure, so we can start rebuilding our roads and our bridges and our airport runways. And people say, oh, well, I like that. Well, how about investment in clean energy so that the solar panels and wind turbines and electric cars are built here in the United States? Well, we fully support that. Well, how about help to the states so that they didn't have to lay off tens of thousands of teachers and police officers and firefighters? Well, we support that. Well, that's the Recovery Act. What I just listed, that's what this was. And so, I think that one of the challenges we had 2 years ago was we had to move so fast. We were in such emergency mode that it was very difficult for us to spend a lot of time doing victory laps and advertising exactly what we were doing because we had to move on to the next thing. And I take some responsibility for that. I mean, our attitude was we just had to get the policy right, and we did not always think about making sure we were advertising properly what was going on. But I think that we have the opportunity now that the economy is more stabilized to be as clear as possible with folks about what we've done. Last point I'll make. People have a legitimate concern, I think, about the debt and the deficits. And a lot of the emergency steps that we took in 2009 and then the first half of this year did cost money and added to the deficit. So the key issue here is that had we not taken those steps, had we dipped into a depression, had unemployment gone up to 12 or 13%, then the deficit would have been even worse. But that's kind of a hard argument to make, and I think people have a legitimate concern, a legitimate worry as to what are we doing to start, now that we're out of the immediate crisis, but we're only experiencing sluggish job growth at this point and sluggish economic growth. How do we get back to a point where we're living within our means? That's an entirely legitimate concern. It's a concern that I have. And we're going to have a serious debate over the next several years about how to do it. The problem I have with the argument, the way it's playing out right now in the country, is that there's a suggestion on the other side that somehow the problem with our debt and our deficits all arose magically the minute I took office, whereas, in fact,